The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. My name is Kate Sweeney, and I will be the moderator for today's webinar. I have a few housekeeping items to go over before we get started. First, this webinar will be recorded and available beginning tomorrow morning on LiveWell Colorado's website. To access the recording, simply visit livewellcolorado.org, click on the LiveWell Commitment tab, click on Research and Publications, and select Webinars. Second, we will have time for question and answer at the end of the webinar. If possible, please let us know who your question is directed to, especially since we have a lot of panelists today. And we'll be to do that, just simply type into your questions tab on your control panel. And now I would like to turn it over to Lisa Walvard, who will introduce our speakers and go over today's objectives.
Great. Thank you very much, Kate. We're really excited about today's session on increasing fresh, healthy options in early childhood settings. There's been a lot of work done within the K through 12 school systems to improve access to healthy food, and not as much has been talked about in the early childhood settings. Yet more and more research is showing us that kids are making kind of setting habits and forming good behaviors early on in life. So this is increasingly important that we as a state and individual communities are paying attention to it. We're really fortunate today to have a lineup of some incredible speakers with a wide range of experiences in this. Most of them are not experienced webinar presenters, and they're really on-the-ground people who can tell you about what's happening. So we're really excited about that. And as Kate mentioned, we do ask that you submit your questions as we go along. So if you hear something from one of our speakers, call out their name in your question and what your question is. We will most likely hold the questions for the very end, but if there's some where it makes sense to interject, we may do that as well. So our objectives for today are to get a sense of both the differences in both rural and urban settings for how early child care centers are using and increasing healthy food options, to learn about the programming to promote healthy eating. So we need to have the access and the options, but we also need to train the kids, and to learn about some of the resources, including some funding for increasing healthy food in child care settings. So we will, we've got 5 different speakers, as you can see on the agenda, and then we'll have a few closing thoughts and then open it up to Q&A. So we always like to share the smiling faces of our beautiful presenters, so you can see right here who you're going to be hearing from. And first up is going to be Robin Anthony, who is the Operations Manager for the ABC Child Care Centers in Greeley. And she's been with them for 25 years in a variety of positions, but currently oversees HR and operations for the corporation. And with that, I'm going to turn it over to Robin to talk about healthy menus in kids' gardens.
Thank you for that. Hello to everyone. If we could move to the first screen, thank you. That's simply our logo, and I thought I would give you a little bit of information about scope of programs for our centers. We are in northern Colorado, in Greeley predominantly, and we happen to be a privately owned facility. So we have 2 large full-day child care centers. We also have a 3rd large facility where we have half-day preschool programs where we are offering the Colorado Preschool Program, or CPP program, as many people are familiar with. And then lastly, we have 9 before and after school age centers where we are actually located in elementary schools in our community. Go ahead and move to the next screen. So for us, major changes we wanted to make really started with our ownership. Our owner happens to be a secondary teacher who had a home ec degree from way back when. And so she had a great passion to make sure that the meals that we're providing for children are healthy. So as a group, we went back to our menus. We do participate in the Child and Adult Care Food Program, And so we were inspired to, with changes that they're making, to step up what we were doing. So we basically had 4 goals when we wanted to revamp our menus. One is to reduce the amount of sugar in the items that we were providing for children, reduce processed foods, increase fresh fruits and vegetables, and then lastly, increase whole grains. So this is an example of one of our school-age after-school snack menus. And what we did, again, were just those things. We increased whole wheat products. We reduced processing, although it's very difficult if people provide just after-school snacks. If you're purchasing items from a vendor, it's difficult to find items. So we really had to collectively put our heads together and come up with items that we thought were very doable. Next screen. This is a sample menu of our preschool or full-day childcare. There we're providing breakfast, lunch, and an after-school snack. You can see that any bread products that we're providing are whole grain or whole wheat. We changed our pastas. All pastas that we're providing now are whole wheat pasta. We changed our grains from maybe what was a parboiled rice to brown rice. And then, of course, increased our fresh fruits and vegetables. Now, if you participate in the CACFP, which is the Child and Adult Care Food Program, you know that many times commodities are a part of that. So with the commodities, we have fewer choices, but we opted that if we were using canned goods, such as canned vegetables or canned fruits, that we rinse all of our products before serving, so to reduce the amount of sodium and sugar on those items. Next slide. And then this, lastly, is one of our menus for our CPP program, which again is a half-day preschool. These children attend just 3.5 hours a day, and so children in the morning are receiving a breakfast, and children who attend in the afternoon session receive an afternoon snack. So again, even items such as pita, we changed to whole wheat, breads, toast, English muffins, bagels, even soft pretzels are all whole wheat now. Now originally when we made this change, it was difficult to find items that met our criteria. So we had to go to our distributor and very specifically ask them to begin to look for us. So with a little bit of searching, we were able to find the products that we like and we believe meet this criteria. One other large section of making menu changes is obviously educating our staff to support these menus, and then educating our families. And it's more than just what we're doing in a menu or in a classroom, but we decided to extend that to gardens. Next slide. This is just a picture of some of our garden area. We happen to have space available where we have raised beds and a kid-controlled or kid climate garden. So we actually have fruits and vegetables as well as flowers. And this is some of our youngest participants. Next slide. We found that part of the education was obviously hands-on for kids, but also hands-on for parents. Next slide. And these are just a few pictures of our little ones participating and helping to water the garden. Now, part of the garden is learning with curriculum. So we tie in planning, planting, caring, and harvesting. Next slide. And here it also shows you the raised beds, but in the background you can see some large white containers, so we have actual large pots as well. This is our large center, which we refer to as ABC West, but we happen to have a smaller center more in the middle of town in a residential area, and we don't have this type of space available. So we use basically what some would refer to as a patio garden, or we use those large pots, and the children there attending that facility also get to participate. Next slide. Now in the background here, you can get a better view of how large our gardens are. Again, the raised beds, individual classrooms are responsible for different beds, or they'll also plan and decide what they wish to plant. And next slide. And then in addition to that, to the right of this slide is another area where we have a large enough garden area that we were able to offer plots, garden plots, to our families. So if they wish to come and plant a garden as a family and care and tend for it, they could do it right here on the child care grounds. And that's all I have to share.
Great. Thanks so much, Robin. We're sitting here just enjoying the photos and wanting to get out with the kids in the spring. It's pretty impressive. So I know a lot of people, probably not too many places that have the luxury of that space, but some great inspiration for those who might be able to get access to it. Great opportunity possibly to partner with municipalities that may have space available as well. Next up we have BryAnne Goddard from High Desert Head Start. And she's been in southwestern Colorado since she was a teenager and has focused her career on the importance of good nutrition in young children for the past 10 years.
Hi, thank you. So I am the cook at High Desert Early Head Start, and I actually helped to open this center. I started when the center opened. Previously, I worked with Colorado Cooperative Extension for 7 years, and I taught FNEP for 6 of those years. FNEP is a nutritional education program that's focused on teaching limited resource families how to feed their families healthy food. It was during that time that I realized that I loved to work with children. And if we could go to the next slide. Over the course of my time there, I spent time evaluating how I could make the most difference in these children's lives over the long term. Next slide. I decided that if I was the one cooking for them a good portion of the day, at a very early age, I could teach them that healthy foods are not only tasty, but that we don't need all those extras. At High Desert Early Head Start, we have kids from 6 weeks to 3 years old, so I can make an impact very early on in their lives. The children are here for 6 hours a day, so we meet 2/3 of their nutritional needs in a day, and that's a pretty big deal when they're so tiny. Next slide. So what we do at High Desert is we focus on serving fresh fruits and vegetables as often as possible. I do this for multiple reasons, obviously for the nutritional aspect. I want the children to eat as many healthy foods as they can in the limited time that I have them each day. Next slide. The taste of the food, if it's fresh and in season, is going to taste good, and it's going to make it easier to get the children to not only eat it the first time, but from then on. Since we have our children at such an early age, we really want to be able to show them that foods taste good on their own, and we don't need ranch for our jicama or syrup on our French toast. When we do have infants in our center, I prepare all of the baby food. I've invested in an inexpensive chopper as well as a smoothie maker so that when the children have something like sweet potato fries, which of course is fresh sweet potatoes peeled, sliced, and baked, I can just bake an extra sweet potato and toss it into the smoothie maker or chopper depending on the stage our children are currently at, and they get fresh homemade baby food. Next slide. Something that I've noticed is as parents, we sometimes forget that just because we don't like something and don't prepare it doesn't mean that our children wouldn't love it. I think that as parents, and adults, we need to forget our prejudices about certain foods. A lot of our parents are shocked at some of the foods that we offer and are even more astounded that their kids eat it. I once mentioned to a parent who that we offered raw bell peppers to our kids, and they didn't believe me that their child would eat it. And of course, it didn't have any dressing. And they had never really thought of offering their kids anything like that at 2 years old. And it seems like many of our parents want to wait until the kids are a little bit older for healthier foods, not realizing that if we start them earlier, that it'll be better for them in the long run. Next slide, please. As hard as it may be to get children to try new foods, there are some pretty simple tricks that I use in our center. It seems like the first bite is usually the biggest hurdle, especially if it looks a little funky. With children, it seems like ownership seems to be a pretty big key. Next slide. I've had children who refuse to even think about trying something like coleslaw. Next slide. When the teacher tells me this, then I can plan the next time that we have coleslaw in the center. I'm going to go and get a couple of kids from that class and have them help me stir in and dump all of the ingredients, and suddenly it's not coleslaw, it's Harry's coleslaw, and everyone is eating it up, even little Harry, who didn't like the way it looked last week. Next slide. At our center, we also try to buy Colorado-grown produce. It's not always an option, but as often as possible, that's the goal. Our Tri-County Head Start has been working on getting the Farm to School program introduced in some of our centers, and that would obviously make it a lot easier to serve local produce. To help supplement our produce in our center, we have a small garden, not nearly as gorgeous as Anne's, but we're there. The way we manage our garden this year is that we're asking each of our families to donate 1 package of seeds. We are a relatively small center, so we are planning our garden that way. As far as maintenance, we're having each of the families come in for a week and water and weed the garden so that the children as well as the families as a whole have ownership in what we're feeding our children. This also gives us the opportunity to send home vegetables that maybe they've never tried, for example, kale or things of that nature, as well as making it really easy for the children to experiment with the foods in the classroom so that they become more comfortable with them before eating them. So, for example, how fun would it be for the kids to be able to paint with zucchini in the classroom so that they can experience it and not be so afraid of it when it shows up on their plate. Or how exciting to see that there's some pretty yummy food inside that big brown furry coconut. We also stick to the CACFP guidelines for offering formula or breast milk until they turn a year, and then whole milk from 1 to 2. And then from 2 until their 3rd birthday, when they graduate with us, they get 1% just as another way to show them to make lower fat choices and that healthier foods do taste good. The meats that we offer here at High Desert are as fresh as we can get them. If we have chicken nuggets on our menu, then it's going to be chicken breast that I cut up and dip in breadcrumbs and bake in our oven. And as a parent of a child that goes to this center, I love the fact that I know exactly what my child is being fed and that it isn't just spare parts thrown into a form and breaded. So how we manage to make this all work is, first of all, I work on time management as often as I possibly can. So I ask myself all the time, do I have time to make a double batch of biscuits so that I have extra in the freezer for later this week? And then we all know the necessary evil of documentation for everything that we have to do. So finding a way to make that go quickly every day by finding little tricks that work in my center has freed up a lot of time so that I can spend more of my time making healthy foods for my kids. Secondly, I have amazing coworkers who care about these kids as much as I do. So from the wonderful ladies at our central office who change up our menus numerous times a year to keep the kids excited about the foods that we have coming in, but are also more than willing to let me have a little leeway and switch things up if we have a sale at a local store. To the teachers who, even though the thought of fish makes them queasy, will make happy faces and tell the kids how yummy it is. We're all a family, and we want the best for each other, and healthy eating is a big part of that. I mentioned ownership a couple of times, the kids having ownership, the parents having ownership. For me, the most important ownership is my own. This is my kitchen. These are my kids, and I want everyone who walks in to know that my center is the best it can be, and I'll try my hardest every day to show that through the foods that I cook and offer my kids. So, that's all I have today.
Thank you so much, BryAnne. I think that was great, and we appreciate the your ending comments on how you make it work. And I think that people you surround yourself with is always so important in the, thinking about who those parents are, who the teachers are. It does take a village, and having some of those shared values is so important. So thank you for your comments and your fun pictures. And I want to remind everybody on the call to please submit your questions. If you've got questions for Robin or BryAnne, to go ahead and indicate who they are for, and as we continue to go along, to submit more questions. So next up we have Ann Zander. She's a family and consumer sciences agent with the Boulder County Extension. She started her career in education with teaching at a high school in rural Wisconsin and got to Colorado as fast as she could, right? She was also with Cornell Cooperative Extension, University of Minnesota, and then finally got here in 1996. So we are very fortunate to have Ann to share about Family Matters Improving Health Together.
Thank you. Just wanted to say that what we're talking about now, both myself and Sheila Gaines, who's from Arapahoe County, we're really excited about sharing this free monthly newsletter that's written in English and Spanish. That's called Family Matters. So we can get started here. This is a peer-reviewed newsletter that's written by Colorado State University Extension agents. Sheila and I are just two of the ones that write for it. And we distribute this throughout the state through various county extension offices. And some of them, like Pueblo County, distributes to families and agencies through their community food share sites. Then Denver County tells us that they distribute electronically through an agency mailing list. I know that Arapahoe, Boulder, and Eagle counties, and again, these are the main authors of the newsletter, we distribute electronically and in hard copy to all of those groups besides child care providers, family child care providers, the centers, the home schools, Head Starts, food banks and pantries, libraries and things that you can see on here, but also gardening projects that are going on in our counties. And we found sometimes that even the farmers markets will take our newsletter and distribute it because of the theme behind it. Next slide. Here's a copy of the one-page front and back issue that Sheila wrote in 2013. I know you cannot read it, but it's to give you an idea. It is just one page, and articles are written basically to promote a specific strategy that we want to help families increase their physical activity or to enjoy healthier foods. Everything that so far two presenters have talked about. The objectives of each issue are to inform, to educate, and to motivate the reader to make changes in nutrition and health behaviors. If you can go back to the previous slide before this one so they can, yeah, thank you. The total article length is only 800 words. And that's not a lot. We have all of the space that we have to use for marketing for Colorado State Extension. And then we have this little space that we have to write our articles. So we basically have broken it down into the background information, which is about a specific topic or a strategy that we've decided in the year to do. And that will give about 200 to 300 words to. Then sometimes we'll have tips for success, and that's where we can list about 4 to 10 tips, and we'll use bullets or we'll use a table to summarize those tips or the strategies we're trying to stress there. The Let's Talk section was an idea that Sheila came up with, where she said, let's provide some tips on how to communicate that health message to the parents so they can communicate it to their children. Well, we have 100 words that we can do that in. But this is a way that we help the parent or caregiver to be a mentor and to set a good example. Then we have the famous recipe for health, or it might be an activity for health. This has to be simple, it's got to be affordable, and it has to be, if it's a food item, easy to prepare, and if it's an activity, easy and free to do. So we test and we adjust all the recipes before the submission. Sheila is great with that, and she's got a family that does the taste testing, because we don't want families to fail. And sometimes those recipes do need some tweaking. So we want to make them appealing to the eye and good for the taste buds. We also try to write for a 5th to 6th grade reading level, and this can be really difficult, and all of you, I think, can relate to this when we're talking about with nutrition terms. It's a constant challenge for us. The newsletter will focus on information on tips and to help the parents, or maybe even grandparents or caregivers of children, to promote that healthy eating and that active lifestyle. We have all read the research that's out there, so we know that helping kids stay active, and our 2 speakers have mentioned it before, we need to encourage healthy eating patterns, we need to promote those choices, we need to get enough sleep, and we all need to work together to help reduce the risk of childhood obesity and the problems that are associated with that. So now the next slide lists the 2014 topics, and variety is key in our topics. All of the 2013, 12, and 2011 topics are archived on the CSU Extension website, and you can see that link at the bottom of the page. So you can go to that link. It'll take you to CSU Extension's website, and then you can downlink a free copy electronically in English or Spanish of those years. We're right now in the process of taking off in the archived copies the month and the year, because we've had requests from agencies and child care providers and family providers that really they want to use some of the archived issues, but the dates, they need the dates off. They just want the title of the issue. So that way you can go into the archived part and you'd find maybe a title such as So You Think You Can Dance. That was a really popular one. Then we also had one called Stop Trying to Exercise, Just Keep Moving. And this will relate to our last presenter, where we had an issue called Teach Kids to Cook, Share the Work, Share the Fun, which is exactly what she's doing at her center. And we'd like to encourage LiveWell communities to use and to help us distribute this newsletter, because this is the main collaboration, especially today, talking and making this presentation. And one final thing is that we would like to, both Sheila and I, share that we've got this great hands-on curriculum, and it's a guide from the University of New Hampshire Extension called Growing a Green Generation. About 8 years ago, the early childhood educators at the University of New Hampshire Laboratory School and the Child Study Development Center came together with an extension agent who also happened to be the 4-H agent, wearing many hats in that particular county. And they got together and they put together this curriculum that got to be known as Growing a Green Generation Project. And it engages infants through kindergartners and an opportunity to learn about the joys of gardening, as well as the people who are really passionate about gardening and growing, whether it's in a container or in a backyard. And the project's been developed into a very, very colorful and very vibrant curriculum. And we can give you that link so you can contact Sheila or I, and then you'll get a free electronic copy of this. And I promise you, this will not sit on your shelf and gain any dust. Thank you.
Thank you so much, Anne. I think you've highlighted very well the incredible resources that CSU Extension can bring to this work, as well as Extension offices elsewhere, as you have noted and highlighted. So thank you for that. And we do encourage everybody to check out the Extension website to find these specific, to find the newsletters and the, some of the other resources, but you can also start to find your local extension agent if you don't already know them and explore ways in which you might be able to partner with them. So really some phenomenal resources that are available all over the state. We did get one question that came in, and Anne, you did answer, but I want to make sure this person heard it, that the Family Matters newsletter is available in both English and Spanish. So that is another great asset that you guys bring. So thank you for that.
Yes, it is. Yes, yeah. We've done a lot with getting the translations, and we always can use improvements in that, but definitely with that. And also with this group, with all the people that have attended, if you've got topic ideas, we would love to get them because we will use them.
Great, and we will, for everybody on the phone, we will, you will have everybody's contact information at the end of this webinar, but we'll also send a follow-up email that has all the contact information and the resources that have been mentioned on this call. So again, please keep the questions coming. We've gotten a couple more, so please do send those in, and if you know who you want to answer them, indicate that, but if you've got general questions, that's great as well. Next up, we have Ginny Puma, who's a clinical assistant professor. She's with the Rocky Mountain Prevention Research Center and the Colorado School of Public Health. She has her doctorate, so I'm sorry, it should be Dr. Puma, from the University of Denver in quantitative research methods, and she's currently a clinical assistant professor with RMPRC. And her research and evaluation interests are in early childhood obesity prevention, community-based participatory research methods, and social determinants of health. And Ginny's going to talk about the culture of wellness in preschool. So if you want to go ahead.
All right. Hi, everyone. Thank you so much for the introduction. I'm actually here with the Culture of Wellness in Preschools project team because it so happens that this webinar fell during our regularly scheduled weekly meeting. So they're really the experts and the one who should get credit for all this work, but I get to talk to you about it. So I'm going to, the Culture of Wellness in Preschools is a project. It's a 3-year project that's funded by the Colorado Health Foundation, and it's a collaborative early childhood obesity prevention project that implements a range of programs and activities aimed at increasing daily healthy eating and physical activity for preschool students, for staff, and for parents. And currently we're working in 21 Head Start sites here in the Denver metro area. I'm going to talk to you just about one of the components of this sort of larger project, and it's a strategic planning process called Assess, Identify, and Make It Happen for Preschools. It was adapted, and Charlotte Farewell, who's our project lead or project component lead for this part, really is the one who adapted it to be appropriate for preschools. But it's based off some of the work that Dr. Belansky has done with elementary schools around the state. And this process has been shown to lead to the implementation of evidence-based environment and policy changes that promote physical activity and healthy eating. And I think if you go to the next slide, you'll get a sense. Okay, so it is an 8-meeting process, and it's conducted with a 5 to 12-person multidisciplinary health promotion committee team. And to give you a sense of who participates on the team, it tends to be center directors or people who are in a position to actually make change in the sites, teaching staff, food service workers, family service coordinators, and parents at each of the various preschools that we work with. So the team participates in a strengths and needs assessment at the individual site level to identify potential areas of improvement related to physical activity and healthy eating. And then they review environment and policy best practices. And that's one of the things I think we would like to share with you. So I know Lisa said that a follow-up email will go out with resources. So we have a list of best environment and policy practices that focus are evidence-based and have been shown to increase healthy eating and physical activity in preschool settings. So I'll be sure that the LiveWell team gets that so that that can be emailed out to everyone. We'll also post it on our project website, which is cowpcolorado.com. So, and then anyone can email me afterwards as well, because I think it'll be a good resource for many people on this call. But anyway, so the group reviews the environment and policy best practices, and then they prioritize changes that they want to make at their individual site. And then they come up with an action plan and a timeline to actually implement the changes that they've selected. And so these, we did this process last year with 16 of the 21 Head Start sites that we were working with, and these are these are the results basically. So I know that this webinar is focused on healthy eating, so I'm going to spend most of my time there. But for this last year, a total of 44 changes were selected across all sites. 15 were child-focused, and then I have, oops, uh-oh, I reduced my slides. All right, let me see if I can go off my notes. You have sorry, my presentation went down on my computer, but the changes were both child-focused and parent and staff-focused, and that was a new addition to this process compared to what has been done in elementary schools. The previous work that we based this work on was just all the changes that were selected were just child-focused, but because we recognized the importance of caregivers and staff, the adults in the children's lives, we made the changes that we encouraged the Head Start sites to select also be staff-focused. So you can see those broken down. And so there were 68 changes for healthy eating. 29 were staff-focused and 14 were child-focused. And then you can see the physical activity changes. We averaged 3 changes per site for healthy eating, and then 1.5 for physical activity. And so you can see the overall changes there. So overall, it resulted in 68 environment and policy changes, which we felt was a very successful year. And then I'm not sure, at least I can't tell which slide you're on since it's not on my computer, but if you go to the table, what you see there is on the left-hand column, you see examples of environment and policy changes that the sites chose. Across the top are the various delegate agencies, Head Start delegate agencies that we worked with, and then you can see the individual sites by the numbers. And in this table, the circles that are black indicate that the change that was selected was fully implemented. The circles that are hollow means that the change selected was partially implemented. And then there's a dash, which means the change was selected, but when we followed up with them, they had not yet implemented that change. Charlotte is following up with our teams 1 month after the last health promotion team meeting, and then 6 months and 12 months. So we'll get a sense of to what extent all the changes were implemented, and we're aiming for everyone to have the changes fully implemented so that they could be sustained. The other thing is that this process results in a wellness policy. So for every site, there will be a wellness policy, and it can be, depending on what the site wanted, it could be in poster format, so it can be posted right when parents walk in, or it could be, it will appear in parent handbooks and staff handbooks, wherever, in flyers, wherever the site, whatever format they wanted, we're working with them to get the wellness policy out so that then there is the chance that the changes will be sustained and everyone that's associated with the center will be on the same page in terms of understanding what the policies are that promote healthy eating and physical activity. So I think that's all. We do have that list of evidence-based or promising policy and environmental changes that we'll send out to everyone. And then we're looking now, we just got another grant to expand to non-Head Start sites here in the Denver metro area. So we're working with the city and county to implement that. So I think that is all. Thank you.
Great. Thank you, Ginny, and your entire team there. This is really exciting stuff. This one, I was excited when I saw it, and good to get more of a sense about it live from you, and congratulations on the opportunity to expand this. and we'll look forward to getting the list of evidence-based practices that we can share with everybody. So to everyone on the call, please do keep your questions coming. We will have a little bit of time at the end to get to all of them. But before we do that, we've got one last speaker. This will be Robin Pulkkinen to talk about rural development funding opportunities. Robin's a loan specialist with the USDA Rural Development. She's been with them for 23 years. The first 17 years she was in the national office in D.C., and the last 5 she has had the privilege of working here in Colorado. And during that time, she has been assisting with funding small businesses, water sewer systems, and community facility type projects in rural areas. So another great source of resources. So Robin, if you want to go ahead.
Thank you very much. Well, I'm excited about the opportunity today to be able to share about our program. I just think it fits really well with all the great things that y'all are doing. And rural development is a mission area under USDA, under the Department of Agriculture. And if you want to move to the next slide, our mission, I just want to give you a big picture of rural development very quickly, funnel down to how it applies to what we're talking about today. Our mission is to increase economic opportunity in rural America and to improve the quality of life in rural America. So what this means, if you want to move to the next slide, is that we basically can provide services in rural areas to meet just about any need in that rural area. And one of our little sayings is that we can build the town from the ground up. Moving ahead. And so the type of projects that we can fund under rural development are housing projects, so we could build the houses or the apartment complexes. We can fund the businesses that are essential in a small community. And of course, we got to have the infrastructure. We want to make sure that you can flush the toilet and you got healthy water coming out of the sink, and the connectivity for Wi-Fi, and also we can fund renewable energy and telecommunications, things like that. But the program that really applies today is our community facilities program, and this one, it's my favorite program that we're able to work with because it has such a wide variety of options that we can help in funding. We can do anything that the community needs to be able to function, to work, anything that they need in that area. So we can do the fire station, the medical clinic, childcare, hospital, daycare, farmers markets, things like that. Just about anything, the town hall, the jail, anything like that we could do. Moving forward, the program, the Community Facility Funding Program, it's a loan and grant program, so we have loans available, and they're 40 years, which make the terms pretty good for our bigger projects. If we're going to build, let's say we need to purchase land for a daycare, or help build the structure or something like that, that might be a good fit for that. But we also have a grant program that a lot of people are interested in, and we love being able to offer this opportunity. And the kind of things that we can do are help with buying kitchen appliances. Maybe you need a new refrigerator to store the fresh vegetables in, a stove. We can do help with the structuring the community garden. As Robin had mentioned, those raised beds, that's something that we could fund. The fencing around the garden that she had shown, those are things that we could do. BryAnne talked about the smoothie maker. That's something that we could help purchase. We were talking about healthy activities. We could help fund playground equipment, anything having to do with that. If you had a vehicle for hauling food to different facilities, we could help with retrofitting that, or even purchasing the vehicle. And or if you need hot boxes or coolers to store the food in when you're transporting it. Those are the kind of things that we could fund. And one of the things that's available under this administration is it's a high priority for, they call it Know Your Food, Know Your Farmer, which means we're trying to give priority to any projects where we're decreasing the number of steps between the garden and the one consuming the product. So if if we have a project where the children are helping out with growing the food right there, you've eliminated a lot of steps going through the store and all those other processes to get the food to the consumer. That's a priority for us, and so we can get a little extra priority scoring when we're looking for funding through those grants. So to talk about our program, there's just 3 basic eligibility criteria. The entities that we're able to work with are municipalities, that would be the towns, the cities, the schools, nonprofit organizations, and tribes, Indian tribes. Those are the 3 types of entities that we work with. And we are rural, so our definition of rural for this particular program is any incorporated area of less than 20,000 in population. So we're really trying to reach those smaller communities that might not have as many resources as some of the larger urban ones. And then, as I talked about earlier, the eligibility criteria for the project is just that it's an essential community facility. Anything that the community just needs to function is something that we can fund under this program. And the other thing I would mention about our grants is they do have a matching component to them, and the grants can run anywhere from 15% to 75% of the project cost. And that's going to be dependent on the population and the median household income of the area. The smaller the population and the smaller the median household income, the higher percentage of grant that we can help participate in a project. And then just lastly, I wanted to, our last slide is just point out that we service the state in 4 quadrants, and so we're just divided up almost straight across and up and down, and so you see the other individuals that are represented here that help administer the program here in Colorado. But if you have any questions to start off, you can always start with me, and I'll point you in the right direction of the specialists that would work in your area with you. And with that, I think that's about all, Lisa.
Great, thank you so much, Robin, and it's so helpful to have those, all that contact information there as well. We did get a question for you already, and that is, can Head Start programs apply for rural development grants?
As long as they meet the criteria as a nonprofit or a municipality, absolutely.
Great. I'm guessing you might hear from somebody.
Super.
So thank you. If people want to keep sending questions, I think we should have time to get through the questions that we have and probably a few more. So somebody asked to put the contacts back up, and we will do that. So just go back a slide. And then, again, we will send that information out to you as well. Robin, we just got another one, and I think we know the answer there, but can home daycare centers apply for grants as well?
As long as they're organized as a nonprofit, yes.
And then another one, we'll keep them going for you. Can you help fund schools installing water stations?
I'm assuming to help with like maybe a garden or something. If that's what we're talking about, then yes, we could do that.
Okay, and it may be more like the replacement of water fountains with water filling stations. So kids are starting to carry water bottles, or empty water bottles, so they can refill their water bottle.
Okay, yeah, that would absolutely be something that we could do.
Love that answer. Thanks for asking that one, Sean. Great. You'll be hearing from a lot of people. This is good business. Okay, I'm going to go back up to the initial questions we have gotten, and please keep sending these questions in. So the first one we received is, do any of the presenters have any experience in developing institutional buying projects, maybe through collaborative or cooperative buying of healthy foods from local farmers or food processors?
This is Anne. I could say that there could be some either agriculture agents or horticulture agents in your county at your county extension office that would have that connection. I know we do have the connection up on campus with the ag and food policy, where we can make those connections with you with possible small farmers in the area to help with some programming, or not programming, with the produce, if that's the question that was being asked.
I think that is. And I know that Wendy, who's here, our food systems consultant, can fill in as well.
Oh, yes. Yeah, Wendy's very knowledgeable.
Hi. Actually, so if you can move to the resources slide. Hi, everyone. This is Wendy Peters-Muschetti. Just a really quick plug for, there is a resources listed on this page here about a food access scan that I did with some colleagues this summer for home care sites and on behalf of the State Department of Public Health and Environment of child care this summer. And this is a question we actually asked directly of home care and child care sites, is if they were participating in a collaborative or cooperative buying from local farms or food processors. On the page you'll see here, there's a link to some of the reports that we did that actually explore regional opportunities for connecting child care with regional food systems. We did like 4 different reports for different regions of the state of Colorado. So you can follow a link here to download those reports. There's also a master report that's much longer that explores much broader issues of food access and affordability for healthy and local foods for child care centers and home care centers in Colorado. And you can email me directly. My email is there, and I can get you a copy of that whole report, which explores this a little bit more in depth. A short answer would be, for the person who asked this question, that when we asked this, at least in our, close to 60 interviews we did around the state, this was not something that was happening in child care, but there was interest in it, and an interest and a feeling that there was possibility to do this. A few preschools where this was happening, more cooperative purchasing, were the preschools that had relationships with their school districts, so that did cooperative purchasing with their school districts. And as BryAnne mentioned earlier, were either partnering with or in or near a school district that was already doing farm to school and could therefore directly benefit from that K-12 farm to school relationship. And Robin and BryAnne, please jump in and add if you have, Robin, Anthony, and BryAnne, if you have anything to add to that.
We don't currently have a relationship here in Greeley. We're large enough that we're not working hand in hand with our school district other than to provide preschool programs, but not with food service.
And this is BryAnne. It's something that I believe that we're working on, but we haven't officially got it in place yet.
Good. So maybe in a year or two that can be a topic for a webinar. See, the next question, and this one everyone is welcome to give some answers to, because I think everybody's had these challenges. How do you get a child who is 3 and already a very picky eater to start trying new foods? We've done food friends. We grow our own food. We let her pick the food for dinner, and she helps cook, but still no luck.
Give her time.
That's right. Don't push it. Just keep trying.
We had sort of a similar conversation here between Wendy and I. We have 6 kids, and we said patience and persistence, and we all feel the pain.
Yeah, it takes a long time for a kid to try things. Heck, I didn't like mushrooms till I was an adult, so it's, I think just the fact of introducing some things and being happy if they are eating some produce and some changing some of the stuff with eating the whole wheat products. If they're turning their nose up to every single thing, then you'd have a concern. But if they're still eating healthy but not every little thing, I think you're okay.
This is Wendy. I'm just going to jump in following Ann Zander, just to plug a little bit more of what Ann was talking about. And just as an example, the kind of outreach that CSU Extension is doing, I think this question also gets to the importance of working with the parents, which is a lot of what CSU Extension is trying to do, is that continuum of it can't be all about what happens at, at school or at child care. It's about the whole family environment. And, all the research points to how parents are models and role models, and having them reinforce this at home is huge. So knowing that you can't do it all on site, but having those kind of tools and outreach and ways to engage the parents so that that's being reinforced at home is obviously very, very important.
Great. Thank you, Wendy. Okay, we have a question for Robin and BryAnne. What are the biggest 1 to 2 challenges you face in implementing these great programs?
This is BryAnne.
Robin. Go ahead, BryAnne.
Oh, sorry. Our biggest hurdle was definitely the initial cost of like our gardens, but we found some local agencies that were willing to put that up for us because we are a pretty small center in a very rural community. And then as far as the gardening, our kids are so young. They're like 18 months, seems to be about the median age right now. Although they do want to be out there and help, you can't get them to focus on gardening for too terribly long. And so a lot of that is falling on the parents. And I think we've come up with a sufficient way to deal with that by having the families come in and help out. That seems to be our 2 biggest issues that we've had.
And for us, the gardens really are not an issue for us. We happen to be large enough that we really use our gardens more as a curriculum learning environment as well as a bonding environment for our families and their children. We are not able to harvest enough product from the garden to actually provide meals for our children, but we do harvest, and then we have really our families take that home for their meals. Our most difficult or biggest challenge has been to find actually a food vendor, so we don't go out to the grocery store and shop for ourselves. We have deliveries, again, because of our size. It was finding a vendor that could find the products that we thought were wholesome enough. We really had to do a lot of research and pushing to finally get items that fell within our curriculum. And then secondly, the cost. If you just go to your local market, you'll know any item that you buy that's organic or has what seems to be less in it is going to cost you more. And that is the same thing with our distributors. So we pay more, but we're willing to make that sacrifice.
Great. Thank you both. I think that's really helpful to folks. We got another question that played on that earlier conversation about the picky eater. Do you feel it's okay to add veggie purees to food to hide the veggies so that the child can get the veggie but not know it?
I personally have never done that. We do some unusual things. This week we offered whole wheat tortilla cheese quesadillas, and they have spinach and shredded carrots in them. The kids definitely thought that was a little odd, but after a couple of times of being introduced to them, I couldn't keep enough in the classrooms. So I think just giving them the opportunity to decide whether or not they like it a few times seems to be pretty key. But I would rather them know that they're eating those healthy things so that they're not shocked by, oh, I do like this later.
Well, even as
I agree.
We eat blended foods. So, you know, it's okay for kids to prefer something that's blended with something more mild.
Yeah.
But in the end, we want them to know what a carrot tastes like instead of hiding it in something so that they can learn to enjoy carrots for carrot's sake.
Great. Thank you. Wendy has one more question, I think, and then then I think we'll wrap up on that one. And again, we will be sending out a link to listen to this webinar as a replay, and we'll be sending all the contact information and the resources that were mentioned.
Yeah, great. So I just wanted to go back to Ann Zander for a minute. And Ann, on behalf of county extension officers all over the place, I know that you had some resources to mention, that extension brings some resources to work with child care centers around installing gardening and gardening skills. So could you just quickly mention what those are?
Yeah, I'll quickly do it, and then Sheila has something to add too, and that is at your extension offices, as I said before, sometimes you have a horticulture agent that might have master gardeners. You'll hear about master gardeners a lot in Colorado. And master gardeners are trained throughout the nation. So you could have living in your county somebody that was trained as a master gardener in Colorado, or somebody that was trained as a master gardener, let's say, in California, and they've moved here. And those people love gardening. And it's funny how they'll be there and that they can help you with more and more things, such as the plants that you're planting and varieties, and also with helping the families, helping them to learn to garden and that too. And then you have your 4-H clubs and that. So contacting Sheila and I, and we'll help getting you in touch. But we're listening both to what everybody's saying and your questions and your concerns about getting vendors, and we'll take this back to CSU and the work teams there. And then Sheila has one thing to add.
I was just going to say, if you want the newsletter, the current month that it's out, contact Ann or I or your local extension agent and get on a distribution list. Otherwise, if you go to the website, it's only things that are a month old or older to get the back issues.
Great, thank you. We'll make sure to call that out in the follow-up email. I'd also ask you all to please look at the follow-up email when it comes out. We do put a feedback survey, kind of going along the lines of Ann just saying, of taking back what she's hearing. We take back what we hear from these surveys as well to better inform how we can make this webinar series stronger and make sure that we're getting the information that folks need around increasing access to healthy foods around the state and improving our food system. So please do take a few minutes to get that. Thank you all so much, and please do look for the email from us with the follow-up, and consider attending our next webinar, which will be more relevant to some of you than others, but it's programs, tools, and trainings to connect farmers to land and other resources in Colorado. So thank you again for joining our call. Thank you to our incredible group of panelists and the incredible experiences and resources that you have brought to this group. So thanks, and have a great afternoon.